Hirschprung's disease or congenital aganglionic megacolon. It is a congenital absence of parasympathetic ganglionic nerve cells from within the muscle wall of the intestinal tract, usually at the distal end of the colon. So here there will be congenital absence of parasympathetic ganglionic nerve cells. Due to that, there will be blockage or the intestinal tract at the distal end will be distended and dilated. The main incidence is 1 in 5,000 live birth. Male to female ratio is 3:1. The etiology is genetic cause, arrest in the embryonic development. Here, arrest in the migration of parasympathetic nerves occur before 12th week of gestation. It will not be takes place. The main pathophysiology of this condition, due to absence of ganglionic cells, there is a lack of peristalsis in the affected portion. That's why there will be functional obstruction of colon, then accumulation of gas and feces proximal to the defect. Enlargement of the colon occurs. That's why it is called megacolon. So in pathophysiology, due to the absence of parasympathetic ganglionic cells, there is no peristalsis occurs in the affected portion of the intestine. The section narrows, so the no fecal matter will be passed through it. The intestine above the affected section is distended due to the accumulation of fecal material. That's why it will be dilated. The hypertrophy of muscular area and ulceration of mucus may be occur. The internal rectal sphincter fail to relax. There will be abdominal distension and constipation. The main symptoms that occurs in newborn is failure to pass meconium within 24 to 48 hours after birth. And the child will be reluctant to ingest fluid. Bile stained vomitus can be seen. Abdominal distension, constipation, dehydration also may be seen in newborn. But in case of infants, there will be failure to thrive, constipation, abdominal distension, impulsive diarrhea and vomiting, fever and severe lack of energy will be seen. In older children, there will be constipation that gradually get worse. Then fecal impaction, passage of ribbon-like foul smell stool, anorexia, irritability, malnutrition, delayed growth. So, passage of ribbon-like stool is very important in Hirschsprung's disease. It may ask as a one-word question. The diagnostic evaluation of Hirschsprung's disease is in newborn, the child is failure to pass meconium within 48 hours of birth. Then rectal examination. In rectal examination, we can identify the distension and the blockage, narrowing of the area. Then in for x-ray also can be identified the distension of the material or distension of the bowel. Then barium enema that can be see the narrowing and distension. Then anorectal manometry, there will be failure of the internal sphincter to relax. Then in rectal biopsy, we can see the absence of ganglionic nerve cells. So here it is the confirmatory test for the Hirschsprung's disease. Rectal biopsy is the confirmatory test for the Hirschsprung's disease. Here, when we are observing, we can see the absence of ganglionic nerve cells. The management include colostomy and ileostomy according to the site of decompression. It will help to divert fecal matter and give rest to the bowel. The definitive surgery is the removal of a ganglionic non-functioning part of the bowel by anastomosing to improve function of the intestinal rectal sphincter. Definitive surgery include Swanson procedure, Duhamel procedure, Soyev procedure. The approach used in Swanson procedure is abdominoperineal pulse through. In Duhamel's procedure, retrorectal transanal pulse through we are using. Soyev procedure, endorectal pulse through we are using. So these all are the approach we are used in the definitive surgery, and it can be done laparoscopically. In older children, isotonic enema, stool softness and low residue diet is recommended. In case of treatment of enterocolitis, we are doing the colonic irrigation with normal saline, evacuation by surgical decompression by doing colostomy or ileostomy, and after that 1 month later we can prefer the surgery. The main complications occurs before the surgery is enterocolitis, hydroureteronephrosis, bowel perforation, water intoxication, etc. Intraoperatively, anesthetic complication and excessive hemorrhage. Postoperatively, there will be anastomotic leak, stenosis, constipation, fecal incontinence, diarrhea, enterocolitis can be seen.